Welcome to the deep dive. Today we're looking at something pretty fascinating. How medicine, the institution we see for healing, might actually be growing into a powerful force for social control.
It's a really provocative idea.
Yeah, and our source for this is a 1976 article by sociologist Irving Kenneth Zola titled Medicine as an Institution of Social Control.
A classic piece, really.
Our mission today really is to unpack Zola's argument. He suggests medicine is becoming this new place we go for truth, making judgments not based on law or morals, but on, well, health.
Right. And what's really interesting, Zola argues this isn't some overt power grab, it's subtle. He calls it medicalizing everyday life.
Medicalizing.
Yeah, basically making the labels healthy and ill apply to more and more parts of our lives. It kind of quietly expands medicine's territory.
Okay, so let's dig into that, this medicalizing process. Zola points out four main ways medicine extends its influence, right?
That's right. 4 key ways.
The first one, you mentioned the scope expanding, just broadening what doctors think is relevant. How does that become control, though?
Well, it's about how the definition of relevant changed. Medicine shifted from focusing just on specific disease causes, like a single germ,
Okay.
to what Zola called a multi-causal model. So suddenly, doctors aren't just looking at your fever, they're asking about your job, your sleep, your worries, even, social conditions.
So everything becomes potentially a medical issue.
Exactly, especially with chronic diseases. Suddenly your diet, your exercise, how you live needs managing. Zola even mentioned doctors getting involved in wider social issues like poverty affecting health or debates like diet by decree.
Diet by decree. Wow. Okay, so that's broadening the scope. What's
Right.
the second way? You mentioned medicine-specific tools.
Right. The second way is medicine's pretty much absolute control over its technical procedures. Think surgery, prescribing drugs.
Okay, so how does that extend control beyond just treating illness?
Well, think about the scope of those procedures. Plastic surgery, for example. It went from just, say, repairing injuries to, well, changing features for aesthetic reasons. Breast size, nose jobs, wrinkles, that shaped social norms, right?
Yeah, I see that. And drugs.
Oh, especially drugs. Zola points out the biggest growth wasn't even for clear physical diseases. It was for psychosocial states. Drugs for moods, to help sleep, to wake up, manage appetite, ease depression. Basically, a chemical toolkit for navigating life.
A chemical solution for living, as you said. Okay, point three.
The third one is medicine gaining almost total access to what were once considered taboo areas, things concerning the inner workings of our bodies, our minds.
Stuff we didn't used to talk about openly, or at least not with doctors.
Exactly. And the logic becomes, if it affects the body or mind, well, it can be defined as an illness.
And therefore,
It falls under medicine's domain. Zola uses examples like aging or pregnancy. Used to be natural parts of life, now heavily medicalized. Same for things like alcoholism or drug addiction, once seen maybe as moral failings, now primarily medical problems.
that shift is huge. He mentioned birth statistics,
Who
right?
did? Said that just 70 years before his article, most births in the U.S. were outside hospitals. But medicine claimed the whole process, prenatal, delivery, postnatal, pediatrics, fertility, sex, even genetics. It's a massive expansion.
Okay, and the fourth way, something about language.
Yeah, the fourth is how medical language, medical rhetoric starts being used everywhere, for almost any cause.
How so?
Well, Zola says the prestige of almost any proposal gets a huge boost if you frame it in medical or scientific terms.
Give me an example.
Think about politics. We talk about a healthy economy or an unhealthy political situation. A politician's physical or mental health becomes a major issue. Even environmental problems, it's not just pollution anymore. It's framed as a threat to our health or survival.
Yeah.
It uses that medical authority.
Right, leveraging that idea of health as this ultimate good. So bringing this all together, what's the impact on us, the individuals? Zola talks about an omnipresence of disorder. That sounds
I think
unsettling.
it's pretty unsettling. Back then, surveys showed like 50 to 80% of people had some kind of clinical entity. It leads to Zola's punchline. Living is injurious to health.
Just being alive is risky.
From this perspective, yeah, every choice, every habit carries some potential medical risk. And this matters because health is seen as this paramount value. And crucially, only one group doctors gets to diagnose and treat it.
So they become the gatekeepers of this ultimate value.
And Zola argues their decisions about what needs treating might be driven as much by their values as by pure science. He pointed out how alcohol, despite its harms, wasn't really in the drug safety debates back then, but marijuana legalization faced huge hurdles, even though lots of prescribed drugs had serious side effects.
That really makes you question where the lines are drawn. and how it affects our personal freedom, our autonomy. Zola mentioned genetic counseling.
Yeah, even something seemingly helpful like genetic counseling. A doctor might advise against marriage based on genetic risk. But Zola insisted, hang on, people should know all the options. Live with the risk, consider adoption, abortion, artificial insemination, maybe just not have kids. Don't just present the one medical recommendation.
It's about informed choice, not just medical direction.
Right. He also critiqued things like automatic multiphasic testing, those big health screenings. Great for catching things early, maybe, but institutions were using them to deselect people for jobs or insurance based on potential future problems, often without taking any responsibility for the person screened out.
Wow. So using medical tech to exclude people.
That was his concern. And it leads to his biggest warning, perhaps.
Hmm.
These labels, health and illness, can be powerful depoliticizers.
Depoliticizers, meaning they take the politics out of an issue.
Exactly. Instead of debating fundamental rights like individual freedom over one's body, think about historical debates around homosexuality or abortion. The conversation shifts. It just becomes about how and when to manage the supposed illness.
It sidesteps the ethical or rights-based argument entirely.
Yes. Zola feared we could become so focused on achieving perfect well-being that we'd sacrifice liberty without even noticing, creating, in his words, a kind of scientific environment, like a well-managed but ultimately unfree chicken farm.
That's a stark image. So this deep dive definitely gives us a lot to think about. Zola himself wasn't totally against medicine, was he?
No, not at all. He actually said he was willing to live with some mistakes or frustrations if it meant that authority got shared more. If patients, the people whose lives are affected, had more say, he believed patients have a lot to teach doctors.
A call for partnership, maybe?
I think so. It really pushes us towards critical thinking, doesn't it? If medicine's power keeps growing and we accept that just living is inherently risky, what kind of society are we actually building?
That's the big question. So for you listening, here's something to mull over. Where do you draw that line? The line between using medical expertise for your well-being and maintaining your own autonomy in a world that seems increasingly medicalized?
Are there parts of your life you now see might have been subtly medicalized without you really thinking about it before?
Definitely food for thought. That's all for this deep dive. We hope this gave you a shortcut to being well-informed. Until next time.